let's dive into a vaginal delivery. I will first start this off by saying I'm not a labor and delivery nurse, but I do have a lot of education when it comes to this and go to a lot of different deliveries. But whenever you do have a vaginal delivery or whenever you're pushing, you're going to feel like you're having a bowel movement, like you're going poop. You're going to kind of bear down, if you will, like that. And so sometimes people do poop, and it really kind of freaks moms out thinking about the possibility of pooping in front of other people. And I get that. But whenever we actually see it, we're like, all right, she's pushing good. Like, we know that you're using those muscles that you should be using, and we're not weirded out by it at all. We just kind of wipe it away and go, and don't make a fuss about it whatsoever. If you do not want to know if you poop, like, let your labor and delivery nurse know, like, I don't want to know. Don't tell me. If I ask, like, don't even mention it to me. So it's up to you if you want to find out or you want to know about that. But you should be pushing and using those same muscles down there. You can push in whatever position you want, whatever feels right for you. And you may think in your head, oh, I'm going to be in one way. And then whenever it's time to push, you naturally in your body feel like this isn't the way that feels best for me in this moment. And that's okay. You can do whatever you want. And the hospitals have different things like a birthing ball, so you can birth like on your side, the peanut ball, and kind of help with your legs, keeping them open, and you can use that. You can also use a squatty bar, so usually they're on the beds, and you can either be on the bed or holding onto it over the bed and hold it to squat down. You can be in your hands and knees on all four. You can be on your back if you want. Some providers say, no, we're going to have her push on her back, but that is up to you, however you feel. It does kind of close your pelvis the way that you're pushing on your back, and so that may be something you're not feeling. You can push like holding onto something up top and not just the bars. Whatever you want to do is okay. Labor wise, you can also do whatever feels right for you. Even if you're hooked up to monitoring, you can still move around. And even if you have an epidural, they can move you quite often, so you're getting those feelings of moving. I have a picture inside of here for you that just shows an ideal of different ways that you can labor, different ways you can position. And I think this is a good conversation to have with whoever your support person is going to be inside of the hospital, which ones you would like to do and which ones feel right to you. And just keep in mind, like everything, this may change as you actually go for labor and delivery wise. When most people think about time to push, they think about being 10 centimeters dilated. That's how wide your cervix is. And you think, okay, 10 centimeters is where I need to be to get my baby out. And that's that golden thing that they're looking for. But that's really only one piece of the puzzle and isn't a big indication as of how quick you're going to have the baby, what's going to be happening. People can be like 3 centimeters dilated and walking around for weeks. And while that's not necessarily the case for most first-time moms, because most first-time moms in those early laboring times, they do labor a lot longer. And it's just because it's your first time your body's going through that. So just remember, it's a marathon, it's not a race. You're in for the long haul. Those early labor times, they'll talk to you about, doing like everyday activities to kind of keep your mind off of it between contractions, whether that's like folding laundry, watching your favorite show, going for a walk. Curb walking is really great. You can do whatever you want during that time. Just anticipate as a first-time mom that typically those early labor moments is going to take longer, and that's okay. Granted, some people are really lucky and that's not the case for them, but most first-time moms do labor for longer. Those early times are really important for how thin your cervix are, how it faces, what we call it, and it can be up to 100% thinned out. And so as your cervix thins out, your cervix opens up and dilates. It's not so thick and hard for it to open up. And so that's another piece of the puzzle we're looking at: how many centimeters dilated you are, what a face you are, how thinned out your cervix is. You may hear it called that. And then we're also looking at this station. So that's the picture I have in here showing how far your baby is down in relation to your pelvis. So we think about like negative being higher up top and positives being lower, and 0 meaning kind of engage. So sometimes your baby can be up really high, and this can happen a couple different times. It can just be that they haven't moved down. It can be that your water hasn't broke, and so they kind of have that cushion blocking them from coming down. And if your baby isn't far enough down, they may want to hold off on doing things like breaking your water because they're worried about the cord kind of coming through. So have that discussion with your provider. But we're also looking at how far down your baby is the last piece of that puzzle. So sometimes some moms get to they're 10 centimeters dilated, 100% of face, and you're like, okay, I got everything I need to push, I'm ready. But we actually would like your baby to come down some more before we start pushing. So you may hear this referred to as they're going to let the mom labor down. And that just means that baby is going to kind of come down some more on their own and not trying to push them out. There's also the ejaculation reflex come down the birth canal. So sometimes moms will hang out pretty far dilated, pretty thinned out, and baby just hasn't made their way down, and that's okay. We'll talk about this a little bit more when we talk about your baby's head, but sometimes if they're in your birth canal for a while and slowly making their way down, they may have a really cone-shaped head, and that's going to be a normal thing that you may see. A lot of moms, whenever their baby does get further down, whenever they're 10% or 100% dilated, 10 centimeters dilated, 100% of face, they may say, I feel like I have to have a bowel movement. I feel a lot of pressure down here. And so that's usually our cue to think, okay, I bet baby's down and that it's probably time to push. And they may even give you like breaks in between. And if you feel like you need that, go ahead and let them know. I think communication with your nurse is the biggest role when it comes to a lot of things labor and delivery and postpartum wise. So you've had your baby, you've birthed your placenta, they've checked your placenta and all of that. They're going to have you typically get in the bed if you're not already in the bed. Because remember, you can labor wherever you want. A lot of hospitals even have birthing tubs that you can labor in. Some of them do let you birth in them as well. So after you deliver your baby, you're going to get in the bed if you're not already there, and the provider is going to examine you down there and to check to see if you have any tears. You can have anywhere from a 1st-degree tear, and I have a picture on here that kind of shows those different degrees, to a 4th-degree tear. And a 4th-degree tear is tearing all the way from your vagina to your anus. You may hear it referred to as a vaginal C-section. It's not pleasant, and everyone, I think, definitely needs pelvic therapy after having a baby, but especially those mamas will probably need a lot more support. And just because you tear during one pregnancy doesn't mean that you're going to tear during the next. In personal experience, I actually find that the weight of the baby doesn't determine so much of the tear as the position of the mom with baby coming out, the way the baby's position coming out, because your baby can be positioned a couple different ways. We think about only head down being the position, but actually it can be the way that their face is presenting. You may hear it called sunny side up or face presenting, and you may have a lot of back labor if your baby is positioned like that. But the way your baby's positioned also has a lot to do with it. And also how fast your baby comes out. Sometimes if they come out super fast, moms get a little more tore up that way. So even though I know you want to hurry up and birth your baby, just kind of keep that in the back of your mind that just because it took a while doesn't necessarily mean that's a bad thing. Whenever you're pushing, your provider may support your peritoneal. So after the provider checks you, they'll go ahead and do any repairs if needed. And I'll talk about that more in taking care of your bottom after vaginal delivery, but they'll go ahead and repair anything if needed. And then the labor and delivery nurse will clean you up. Typically they put an ice pack on, and I'll talk about that more in a little bit. And then they'll also take you to the bathroom. Hopefully you pee, get you cleaned up, get you back in bed, and then they will wheel you over or walk you over to postpartum or mother baby, you may hear it called.